We're going to talk a little bit about childhood cancer awareness. September is actually Childhood Cancer Awareness Month, and so we're a little ahead of schedule as far as that's concerned. But we've had, not too long ago, actually I was talking to Shayla just a minute ago, you all know very well about Tatum Schulte's situation, and she is now 29 months into her treatment. She's had an amputation of that limb that she had the sarcoma show up in. She's got about 3 more weeks of chemotherapy, and then she'll be done with all the chemotherapy. And now the rest of it is going to be issues of living her life from this point forward, getting her prosthesis and going on with her life, and then just doing follow-ups. I was very, very proud of our community and certainly our hospital district and our employees becoming involved in Tatum's situation, and I don't think it's totally out of the ordinary for our community or our hospital to not do something like they did with Tatum and give that support that was so necessary for her and will continue to be so down the road. I was in high hopes that maybe we would catch her in between treatments and maybe she could be here for our talk and let everybody see her, because she hasn't been to Perryton in a long, long time, and from what Shayla has told me is that she's dying to come back and see all of her friends that she left when they moved to Canyon. But as it would be, we weren't as lucky as we needed to. She had some complication with the stump. She got some infection in that. She had to have IV antibiotic therapy. They had to put a port in for that. So she's continuing to fight through all of the complications that you run into with treatment for any type of cancer, and especially in kids. So she's not going to be able to be here with us today, except for in spirit, and she said to let us know that she was thinking about us, and she appreciated everybody that was here. So just a wonderful little kid. What is it about kids? Good gosh. They're so resilient. They're so innocent. They're so trusting. And yet bad things can happen. So I thought it was a good topic to talk about. I think it's something that all of us, I'm sure, have had some run-in with cancer somewhere in our family, and hopefully it's not with a child at all, but that can happen, and this isn't going to go into a whole lot of detail. It's just we're just going to skim the surface, because I guarantee you we could talk for a week about childhood cancer if we wanted to get into detail, and I'm not going to do that to you. So I'll bore you bad enough with just the skimming stuff. So let's see if I know how to do this. Just want to say thanks to the hospital district for the board seeing the good in us having community talks and visits like this. I want to say thank you very much to the kitchen staff for fixing us a lunch today. We really appreciate that, and I want to also throw a special thanks back to Lindsay for putting up with my last-minute detailed discussion we're going to have today. She did all of the PowerPoint, did all the pictures, did all of that for me, and did it in the last 48 hours, because I'm kind of one of those last-minute people. But I wanted to say thanks very much to everybody for that. Childhood cancer. Turns out it is the second leading cause of death in children from 0 to 18. The first leading cause is usually accidents, depending on the age of the child. Then it becomes suicide, homicide, and genetic deformities, we'll round out the top 5, depending on which age group you're looking at. But childhood cancer is our number 2 leading cause of death in kids from 0 to 18 years of age. If any of you have a question or anything along the way, don't hesitate. Throw your hand up. So, what is cancer, basically? And I tried to break that down into the simplest form as best I could, and it's pretty much a disease where normal cells lose their ability to control growth. Normal cells grow and divide and have no control, and so it could be an absolutely normal cell that just kind of goes crazy and starts growing and growing and growing. If that shows up in a specific organ like muscle or in the lung, then we name that cancer for the original cell type that it comes from. So if it starts in the lung, then we call it lung cancer. If it starts in the muscle, as it did with Tatum, I believe, then we call it sarcoma, or osteoma if it's in the bone. So that cell type may show up in other places in the body, and if it does, then we call that a malignant type cancer, and that same cell type will show up in other places. So malignancy usually occurs in a fairly typical pattern with most cancers. Bone cancer is always going to spread first to more bone, but it can also spread to muscle and to organs such as kidney as well as brain. So say we found a tumor in the liver or in the kidney and we biopsied that tumor, what you would find in the pathology report is that its original cell type is still the same. It may look like bone that is growing in an organ that's not supposed to have bone in it. So then we would know that that is a malignant cancer that has come originally or from a primary source, such as bone. So you'll see that sometimes where the definition or the diagnosis will say primary malignant bone cancer. And that just means that they have found that cell type in some other organ system outside of bone. Or it may be lung cancer that shows up in brain tissue along that line. So that's just to give you a little bit of insight as to how we name the cancer, and also a little bit more as far as the malignancy part of it. You can have a tumor with a small t, I always tell patients, that's not necessarily cancer. And when those are biopsied and sent to the pathologist, we get a report back that says that that particular tumor is benign, meaning it's not a cancerous tumor, and we can only make that definition with a biopsy. When he looks at it, he sees that the cells look really normal. They do not look like they're multiplying too quickly, and so he can call that a benign tumor. So benign means no growth and no spread, and malignant cancer means that it's abnormal growth and that it has spread to other tissues or organs. So how common is cancer in children? So 1 in 285 U.S. children will be diagnosed with childhood cancer before the age of 20. And the statistics indicate that there are about 33 per 100,000 in the age group of 0 to 14 years. So that's 12,000 kids a year that will be diagnosed with childhood cancer. As we get older, of course, we see that increases, that ratio increases somewhat dramatically. Most of that is because of the things that we do to ourselves, such as with lung cancer. We know that smoking is a huge reason for lung cancer, and that's one of the reasons that as we get older, our incidence goes up with cancer. So of the cancers, childhood cancer is the lowest percentage as far as age group is concerned. And that'll have some bearing on some other slides that we show coming up. So is that pretty self-explanatory? Stop me if you have a question or something to add. So types of cancers that we see in children, there's a percentage. I won't read that all off to you, but you can tell that far and by far, leukemia is the biggest one. In brain and other central nervous system tumors. Lymphoma is a cancer that we find in the lymphatic system. Neuroblastomas are cancers that are in the nervous system, and they'll be in the nerve that supplies nervous supply to certain organs. In particular, we'll see that most of the time in the digestive tract. Wilms tumor is kidney. Rhabdomyosarcoma is muscle. Bone cancer or osteoma and retinoblastoma is in the eye. So there was a good little thing that I came across that shows some symptoms and signs that you can watch for. Not that you can't have some of those things in just about anybody, so you have to be a little careful that you don't think the worst first. But in a child, the things that we would want to watch for is continued unexplained weight loss. You know, kids in the summertime are always going to lose somewhere between 1 to 5% of weight just because of increased activity and because of them playing in the heat. And that's considered somewhat normal. They should pick that back up when fall comes around and they're maybe not quite as active. So weight loss that continues to fall off and is unexplained, you have a child that's kind of a couch potato, not doing much, not very active, and they continue to lose weight, that may be something that is of concern and might be an issue that you'd bring to their primary care physician's attention. Headaches associated with early morning vomiting in particular. Headaches that occur during the night or that wake you up are usually very unusual, and certainly in kids. Headaches typically can come on during the day, and usually with kids and most anybody will go away as the day goes along, or certainly after you've had a night's rest, especially if it's tension type pattern headache or just from high activity or this time of year too much heat. Body will respond and get better, but headaches that are early morning and especially if they're associated with vomiting could be an issue. Increased swelling or persistent pain in the neck, back, or legs. Those types of cancers would probably fall into the range of what Tatum had with osteosarcoma. That would be the type of stuff that you might notice with them, but you all that have children or grandkids know how active kids can be, and sometimes it's just because they're being too rambunctious that can cause a problem. But if it's persistent, they continue to complain about it, that may be something to bring them in for a follow-up and checkup. A lump or a mass that is, again, I think persistent ought to be on there as well, but a lump or a mass I think is something that most of us that would be an easy one. We would say, yeah, I would definitely look for something like that. Excessive bruising, bleeding, rash, or itching. And I'm going to throw in there nosebleeds as well. These are symptoms or signs that can be typical of leukemias in children in particular. And a leukemia basically is a type of cancer of the blood where the blood cells themselves stop being produced in the correct ratio and amounts. And you may have mostly white blood cells being produced and not red blood cells or platelets. Or you may have mostly red blood cells and not a lot of white blood cells or platelets. So low platelet count can cause that bruising problem, nosebleed problems, can also be something that you'll see. Constant frequent infections, that's also probably leukemias, and primarily because even though they're producing a lot of white blood cells, they're not very good white blood cells. They don't really function as well as they should. So infections may be pretty typical with that. The whitish color behind the pupil is a sign of retinoblastoma, and it would be something that as you catch the light just right in their eye, as you're looking at them, you might notice that instead of that pupil looking dark, that it may be more light in color or white in color. And that can be very noticeable just to the naked eye if it's present and you just catch them in the right spot. So anything along that line that you might see, that would be something to follow up on. Nausea or vomiting that persists is kind of a common problem you see with the neuroblastomas and in lymphomas as well. Tiredness or paleness, that would again be an issue of anemia that would be secondary to leukemia. Eye or vision changes that occur suddenly, that's the retinoblastomas. And recurring or persistent fevers. And that can be any type of cancer, not only in children but also in adults. So a fever that you can't figure out why, they're everything seems to be okay, can't figure out why they're having that, then you always have to raise the flag of suspicion that it could be something like a cancer going on somewhere. Any questions? Okay, causes for concern for cancer. I think that was what that was supposed to say, but that's all right. Causes for cancer in children. Genetics is certainly is the top one that we see, and it's because of changes or mutations in our gene pool in the DNA that's in the body. The DNA is what directs the cell to become what it becomes. And if there's any injury or damage, either in vitro or after a child is born, that can cause an alteration in the DNA, and that alteration in the DNA can then cause that cell not to function correctly. It may cause that to kick on the growth of that cell type, and that may cause the formation of the cancer. That's the number one reason that children get cancers. And an interesting statistic there was that Down syndrome children have a 10% increased risk of leukemia as well. Exposure to ionizing radiation, that's just x-rays during pregnancy and certainly CT scans, because CT scan gives us a lot more radiation than a plain film x-ray does. Back in my day of doing OB, we used to do a study called pelvimetry a lot of times, especially if women were a little late or if they were having difficulty in delivering. We used to take an x-ray of them all the time just to see if the baby's head was going to fit through that woman's pelvis. So we did a lot of just plain film x-rays just to see if there was an issue going on there. But usually we would cover part of the abdomen with a shield, and just all we got was a picture of the head and the pelvis. But if any of you have had x-rays, I'm sure, especially you ladies, they're going to always put an apron on you somewhere if they're going to take a picture of you. And this is part of the reason why. If you're in childbearing years, we have to be concerned that there could be a pregnancy there, and we want to cover that base, make sure that doesn't happen. CT scans, like I said, a CT scanner has about, I wish Shayla was still here because she could give us the absolutes on it. A CT scanner around that big donut that you slide through when you get your pictures actually has a series of about 8 different x-ray machines in there that are spinning, and they're taking pictures while they spin. So you get exposure with a CT scanner that's probably, I'm going to say, 10 to 50 times more than what you'd get with a plain film x-ray. So it does give you a lot more detail. It gives you a much better picture. And in a lot of instances, very important for us to have that. But this is a reason why we don't generally do CT scans on little ones, because we don't want to create a problem if we can keep from it. There's been a lot of talk about environmental exposure to either chemicals, pesticides, or even vaccinations in the past, that might be a cause for cancer or other things like autism and so on. But most of this, I would say, all of the qualified studies that have been done really have not shown any solid evidence that anything along that line is a cause for childhood cancers or for autism either way. So I thought that was a good thing for everybody to know. Any questions? Anything? Everybody good? So I read probably half a dozen articles or parts of articles at least on, what do we do? Because something like Tatum happens and everybody gets upset and we don't know. What do you do? What do you do? And the biggest thing we can all do is provide support. We certainly need to support that patient, but we also need to support the family. They're all going through it as well. And especially siblings of that particular child. We need to really make a huge effort to try and make them a part of this whole process. Not necessarily the cancer, but all of a sudden the other siblings are getting all the attention and I get kind of shoved to the background. So we need to do what you can to try and pay attention to the sibling as well. It's really, really important. Of course, I'm talking to the choir when I say community support. When it came to Tatum, I don't know how many hundred shirts that were sold for Team Tatum stuff, and how many pictures we took just of our clinics and every department in the hospital, and oh my gosh, just there had to be hundreds. I can't imagine how many. So that's just a piece of the whole thing as far as community support. I know that Shayla, there's too many S's in that family. Shayla has been very, very complimentary of our community and all the things that we've done here. Doesn't surprise me a bit. Research, of course, is a big issue, and partially because childhood cancer gets only a very small piece of the research pie. It actually only obtains about 4% of research dollars that are sort of supplied annually to go to research for childhood cancer. And some of that, I'm sure, is because childhood cancer is only a 1% of total number of cancers in the United States on an annual basis. But I think we need to also push as best we can to keep that percentage as high as possible. Those kiddos have the longest life to live. They have the best chance of having a productive lifestyle after treatment. An old geezer like me that might have prostate cancer, I've lived most of my life, and I would certainly want to defer that research to a child that might have another 50 or 60 years to be here to provide what they can provide. So research is a big part of it, but I think we need to make that push to make that a bigger piece of the pie. So for that individual, we want to try and keep that individual's attitude as positive as we can. I don't know how many of y'all follow Tatum and the things that she does, and the posts that you see in Facebook are just unbelievable. Shayla said she's never had a negative thing to say that she can think of. It's always about moving forward, getting better, getting to do things down the road that she misses doing with her family, talking about college, talking about all kinds of stuff. So keeping that attitude, I think, is huge. That pulls you forward and keeps you from having that give up attitude. It's really important, though, to be open and honest. When we talk to children that have cancers like that, I know that none of us want to broach that subject, but not that you'd want to bring it up necessarily, but I don't ever be fearful of carrying on a conversation about how they're doing or what they have or what's going on with them, and provide that positive encouragement, but don't ever shirk your responsibility to meet that head on, because that's what they're doing, and you can only help them with that by having that same attitude. It's really important that they be available, and that's why she's not here today, is because something came up and they needed to get something done, and there's never a question asked. If they call and they say she needs to have a treatment done or she needs to be somewhere for something, they never, it's just okay. That's their first priority. We're going to get that taken care of first. And so being available is really important. And something I didn't get put in there, but I think is really important too, is staying organized as best as you can. I do see occasional patients that come in that have cancer or have multiple health issues. They might be seeing 3 to 5 to 10 different doctors. And I can only imagine, I know that patients that I see still get confused with what I tell them. If you had 10 people telling you what you needed to do, how confusing that could possibly be, and where am I supposed to be, and what am I supposed to take, and how am I supposed to do this or that. So, and this was never my idea, but I've had patients come in that have actual notebooks, and they'll have everything slotted in there, and this doctor's slot is this, and they keep all of the stuff that he does here, and this doctor there, and they have a calendar in the back, and they know everything that they're going to be doing. So organization, I think, is huge, and I think that helps lower the size of the mountain that they're looking at. when they look at treatment for certain things. That organization is huge. So community, support the individual or family, and support research. We've already talked about that a little bit. Is that Tatum? Okay.
No.
Okay. Had on purple. I thought maybe that.
I was hoping I could find some. There were some really cute ones ever, but that little girl is another little one that she's a GoFundMe page. So.
Okay. Okay. Where did you find that? All on Facebook, basically?
Some of the photos of Tatum that I found were on either the GoFundMe page or on her Facebook page.
Okay.
The GoFundMe page had a really cute one of her.
Okay. So that would be a way to maybe help and assist is to go to the GoFundMe page.
Yes, and you can just Google her name. Actually, she has, and I thought this was really cool, she has more hits on Team Tatum than Channing Tatum does, the actor.
The actor.
Yeah.
How
so
cool.
I thought that was that's really cool. I think it speaks volumes to the community too. But
Yeah.
she has more links about her online if you Google Team Tatum than Channing Tatum does.
So more hits online than the actor.
Than an actor, yeah.
Channing Tatum. That's cool. And you just Googled that.
Yeah, I Googled it.
Okay. That's cool. This was a really good website that I thought kind of had an A to Z guide to help how you as an individual or as a community can help support families. I can't imagine how overwhelming that has to be, but that was really good. And the curesearch.org website is a really good website. It has a lot of good information, and in particular on childhood cancer. It goes into things such as, I didn't even think about this, but what if someone gave a monetary donation to that individual, and what does that actually create or cause as far as the family's income? Does it create a problem for them? I mean, they might get a large sum of money and you think that's really cool, but if they have to end up paying taxes on that they don't have, that could create a problem. So this went into some more detail, a lot more detail. It'll take you 30 minutes to read through it and think about each of the ideas that they had, because it is A to Z. But I thought that was it was the best website that I found that had some information about how can we support families. Treatment centers, in particular for Texas, I know there are others in Texas, but these are nationally ranked treatment centers in the United States. And lo and behold, Texas Children's is ranked #1. They do more research on children's cancers than anywhere else in the United States. And I'm not sure, does anybody know if that's where Tatum goes or not?
Yes.
Is it? Okay. So, good deal. St. Jude's, everybody's heard of St. Jude's. That's in Memphis, Tennessee. Aurora, Colorado, and Colorado Children's. And Philadelphia, Cincinnati, and Boston round out the top 5. That changes every year, but Texas Children's is ranked 1, 2, or 3 every year. So, treatment options. Chemotherapy is kind of considered the treatment of choice, because radiation being, even though that's second, just as I said earlier, the more radiation we supply, the increased risk you might have of actually creating a problem. So radiation is second, but and it's second because it is effective, but that's not the treatment of choice. Surgery a lot of times is necessary. As you know, Tatum had a leg removed, and she also had back surgery because she had metastasis up in her lumbar spine. She has a cage and a fixating device in her lumbar spine now that pretty much encompasses most of the lumbar spine. She has zero problem with her low back now, and that's all been treated. But so she's had at least those 2 surgeries, and then I think at least maybe a third one because she had some infection in the stump where they removed that leg and had to go in and debride that. Immunotherapy is another big thing that's coming out where we go in and try and, via immunity, try and get your own immune system to recognize the fact that there's something going on here that's not normal. A lot of times your body can't recognize that because it's still a cell that you have in your body. It's just in the wrong place. So unfortunately our immune system doesn't recognize that as being abnormal. It's a cell that has our DNA in it, so it doesn't know that that shouldn't be there. But there are ways of taking or manipulating your immune system to the point that it can start recognizing that there's a problem there. I saw a deal the other day about injecting cells with, what was that? I want to say like botulism almost, into tumors. Do what? Could have been. Okay. Yeah, it might have been that. Which was kind of wild to consider that you're injecting your body with an infection. But it infects the cells where they're not supposed to be in the tumor, and then your immune system comes to the area and says, well, I know that's not supposed to be there, and it helps debulk that tumor. So that's kind of cool. Stem cell transplants, I'm sure y'all have all heard about that, but the stem cell is taking a cell that's early in its stages of development and removing the stem cell and then utilizing that to replace what may be damaged or injured within the treatment. So in particular, for like leukemias, they'll take stem cells and hold those, put you through the chemotherapy that you need to treat the leukemia, and then give you the stem cells back so that can then start developing and building your own red blood cells back. So lots of other ways to use stem cell transplants as well. I think some of it's autologous and some of it is, in other words, used your own stem cells, and some of it is stem cell treatment from other sources. So there are some pictures of Tatum and her dad, Travis. And I'll get off of that before we start having to need Kleenexes. Really proud of that whole family, though. They've just been amazing. Unbelievable. They've done everything that it says you should do. I mean, they've just been really workers. Travis is a coach, as you know, and he's all about teamwork, and that fits right in with what's necessary. Their family has to be a team. The community has to be a team. All the physicians have to be a team. I mean, it falls right in line, and it probably makes it fairly easy for Tatum to understand why we have to do all of what we have to do. This is our team we're building for taking care of you, and all of these parts are really important, and we need to make sure that we support the team and everybody do their part. So I think him being a coach, to me, I'm sure that fell right in line with what she's been hearing around the breakfast table her whole life. So childhood cancer makes up about 1% of the cancers in the U.S. 12,000 cases of childhood cancer diagnosed per year. Good news, since 1969, cancer deaths have decreased by 67%. That is primarily going to be in leukemias and nervous system type cancers. Some of the others are not so effective, and there are a couple of them that have absolutely no treatment. Once they're diagnosed, there's nothing that we know of that we can do about that. So there's no treatment for a couple of big ones that are in that list. So again, we need more research dollars put into that. Current 5-year survival rate is 83% now compared to 59% in 1970, so that's getting better. But we know, again, only 4% of research dollars go towards childhood cancer, and it is the second leading cause of death in children 0 to 18 years of age. Any questions? Anybody have anything? Or additions?
Not Siewert, I'm just thinking of all the But I need to think there were any symptoms for childhood cancer, and that's been a long years. Has it increased in time?
There is,
Is it what to look for?
well,
Can you repeat that question?
yes, yes. And the question basically is that you've watched your grandkids' kids grow up and never really have seen a list or anything anywhere that's gone over symptoms to look for childhood cancers. And your concern is that something changed, or has there been an increased number of cancers showing up or something along that line? Is that accurate enough? Okay. I'm not as good at paraphrasing as you are, I'm sure. You've had a lot more practice at it, though. So I guess the answer to that question, the short answer is no, not really. But I think the awareness part of it is what's brought that out. Those symptoms that I showed you, that big long list that spells child cancer, those are symptoms that we've had for forever, as far as I know. Now, some of them may be a little bit new, but I'm sure they were all true when your children were growing up as well. I just think that the awareness is probably much more. And another statistics that I saw is that even though we saw that there is a lot of an increased percentage of children that are surviving cancer, there actually is a little bit of an increase in the percentage of children being diagnosed with cancer. But those that are surviving the cancers and those that are being new diagnosis that's still in a good balance. I guess that's the way to say that. I don't know if I said that right or not. We do have an increased incidence of childhood cancer, but the survival rate has actually gone up more tany the incidence.
Give the symptoms for Tatum before they diagnosed her?
Now, I can't speak for them totally, but I think they did find a lump in her leg that was a concern, and that's where the ball all started and got rolling. So, and that was one of those things on that list.
Is there one list on that list? I'm sending it to a couple of parents.
Is there like joint pain with any of that, like leukemia? Is there a component of joint pain?
Yeah, there is. You're exactly right. Some of that joint pain, and that should be on that list as well. Probably included in one of those out there. Somebody had to work at that to make that spell child cancer, I'm sure, they had to figure that out. But joint pain is one of those and it would be one of those persistent things. Kids are pretty active. I get kids come in all the time and they're complaining of hip pain or knee pain, and you sit down and start talking to them about it, and then sometimes the kids will tell you, oh yeah, we were playing parachute or something, and they were jumping off the top of the bunk in the bedroom, and no wonder. Yeah. 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 Some of that's growth pain too, but if it persists, or if you see swelling or redness or heat, then I think it's something to follow up on. She was just asking about joint pain as one of the possible symptoms that you might look for. Yes, ma'am.
I do have a question for you on, speaking from experience, I was 16 and diagnosed finally with cervical cancer, but by the time that it happened, it had already gone from cervical to uterine and ovarian at 16. Now I do know that when you go to a lot of these doctor's appointments, that they don't like to do like pap smears on children, such as, a 16-year-old or something. And the only reason I ended up having a pap smear was because I got stupid and got pregnant. But if it wasn't for the fact that I did get pregnant at 16, what's to say that I would have lost my life due to that cancer? Are they looking at that fact that maybe they do need to check, females a little sooner than waiting until they're like 21 or they become pregnant?
Mm-hmm. No, not really. I don't think so. It would totally depend on that patient's history when they come in to, to visit about their general history. But there would be no symptom that you would have at age 16. Typically we don't do pap smears on girls until they're 21. Even if they're put on birth control pills, a lot of times we don't do a pap smear on them until they're 21. And we do the birth control pills not for birth control, but for cycle control most of the time in that age group. But there are risk factors, and part of that is just getting a really, really good history whenever we do a physical on a child in particular. Any family history there of anything?
See, I only know my mom's side of the family.
Okay.
My dad disappeared while she was pregnant, so it's like I don't have that side of the family.
Sure.
But it was limited family history,
Mm-hmm.
and then I don't think some doctors realize that maybe it's worth looking at, because
Mhm.
like I had the nausea and the vomiting. I would have the wake up with headaches and hurt, and I would cramp really bad, and they just kept throwing, well, here, let's try this birth control instead, kind of thing for cramps and regular.
Exactly.
But
I don't know.
I was just kind of wondering.
Do you have anything to add on that, Rachel?
It's supposed to be not until you're 21 unless for 3 years have been sexually active. So if a patient comes in and will say they're being sexually active within the last 3 years or whatever, then they would probably go out and do a pap smear. But a lot of times it's hard to get that from the person. So
And that's where I was going with just being sure you get a really good history from that patient. Makes it tough, but I mean, the good Lord was looking out for you too. I mean, that evidently. So that's good. You're supposed to be here for some reason. And I can think of one, and I can think of one thing in particular. Yeah, several. Any other questions? Anybody? Well, thank you all for very, very much for coming, and again, thank Lindsay for fixing my slides and having this all prepared and ready to go.
Thank you so much. I really